Hello everyone, I'm Dr. Ashley Collins, and today we are going to talk about a deeply personal issue that affects millions of men but is rarely discussed. Retrograde ejaculation, or what many call dry climax. Engaging question. Have you noticed that during climax, less semen comes out than before, or perhaps nothing at all? If so, I need you to listen very carefully. What I'm about to share could completely change your intimate life and, more importantly, your peace of mind. I recently had a patient, let's call him Mr. David, a 68-year-old man who had worked hard all his life. He was a tough man, the kind who never complains. But when he sat across from me, I saw something I hadn't seen in my years of practice, fear in his eyes. He told me, almost in a whisper, "Dr. Collins, nothing comes out anymore when, well, you understand." He had been living with this for nearly 6 months, bottling up his fear, not telling his wife, thinking he was simply too old, or that this was just how things were when he got older. "Why worry her, doctor?" he said, "and there lies the problem, gentlemen. That silence that is killing us inside." Let me explain something very important. What Mr. David was experiencing is called retrograde ejaculation. Before you think, oh, another complicated name I won't understand, let me put it simply, just as I did for him. Your body is still producing semen. The problem is that instead of exiting the body, it's going the wrong way. It's going into your bladder. It's like a two-way street where someone suddenly reverses all the signs. The most crucial thing to understand is this. Retrograde ejaculation does not mean you are broken or unmanly. It means your body is functioning differently, and there are ways to manage it. The 3 silent causes, why does this happen? I'm going to tell you about the 3 main causes I've seen in my practice. Cause 1, the surgical aftermath, prostate procedures. The first cause is something that seems complicated but is more common than you think. Many men over 60 have to undergo prostate surgery, which is normal. The detail is that these surgeries, especially those done with modern techniques like laser, can affect the muscles and nerves that control the direction of the semen. Mr. David, whom I mentioned earlier, had undergone prostate surgery 8 months prior. He told me everything went perfectly. He could urinate without problems, no longer woke up 5 times a night. Everything seemed fine, but there was one detail no one had clearly warned him about. Ejaculation could change. The science of the sphincter? What Mr. David didn't know is that prostate surgeries can affect the internal bladder sphincter. What is that? Imagine it as a small door that normally closes during climax so that the semen exits the body. When that door is damaged or weakened, the semen takes the path of least resistance. It goes into the bladder. When I asked Mr. David if he still felt pleasure or had orgasms, he said yes. "Then you are not broken, Mr. David," I replied. "Your body is working, just differently." Engaging question. Did you know that the pleasure of an orgasm comes from the muscle contractions, not the fluid volume? This is a key distinction that can restore your confidence. Cause 2, the medication maze, the unintended side effect. The second main cause is medication. Medications, those friends and enemies we have as we age. Let me tell you about Mr. Robert, a 72-year-old man who came to see me a few months ago. Mr. Robert had diabetes, high blood pressure, and high cholesterol. He came into my office very angry. "Dr. Collins," he said, "I've been taking these medicines my cardiologist prescribed, and since then, nothing works right down there." When I reviewed his medication list, everything made sense. He was taking a blood pressure medication called tamsulosin. This medication, which is excellent for helping you urinate better, has a side effect. It relaxes. That sphincter I talked about earlier. The crucial balance. Mr. Robert asked, "So I have to stop the medicine, doctor? Because without it, I can't even go to the bathroom properly." This is where a doctor's work comes in. It's not about giving up everything. It's about finding the right balance. I adjusted his dosage and spoke with his cardiologist. Within 3 weeks, Mr. Robert was noticing changes. The semen was still less than before, but at least there was something. Most importantly, he understood he wasn't broken. He just needed to find the right balance between his medicines. Other culprits, other medications can also cause this, gentlemen. antidepressants, certain prostate enlargement medications, and some allergy medications. I'm not telling you to stop them. I'm telling you that if you are experiencing this, you need to talk to your doctor to see if there are alternatives or adjustments that can be made. Cause 3. The silent nerve damage, uncontrolled diabetes. The third cause is very important because it affects a large number of men, uncontrolled diabetes. Uncontrolled diabetes can damage the nerves throughout your body, including the nerves that control ejaculation. This is called diabetic neuropathy, and it is more common than you think. I'll share the story of Mr. Fernando, a 65-year-old man who had been diabetic for almost 20 years, but never took good care of himself. He told me that at first it was just a little less semen, then almost none, and finally, nothing at all. But what worried him most was that he had also lost sensation in other areas. His feet were often numb, and he had lost a lot of sensation during intimacy. When I ran the tests, I was concerned. His sugar levels were through the roof. I told him, Mr. Fernando, we not only have to work on your intimate life, we have to work on controlling your diabetes, because otherwise, this will continue to worsen, and you will have more serious problems. The hopeful turn Mr. Fernando got. Serious. He started taking care of his diet, stopped drinking sodas, and cut back on excessive carbs. He started walking every day and took his medications religiously. And guess what? Within 3 months, he was seeing changes. It wasn't like when he was 30, but he improved significantly. What these extraordinary cases show us is that the male body is more resilient than we think, but it needs us to take care of it, to pay attention and not to ignore the signals it is sending us. The path to solution, action, and communication. So you might be asking, okay, Dr. Collins, I understand why it happens, but what do I do about it? How do I fix it? Here is the good news. There are several things you can do. Step 1. Talk to your doctor. The first step of courage. The first and most important thing is to see your doctor. I know many men are too proud or embarrassed to talk about these things, but understand this. Your doctor has seen everything. Nothing will surprise them. And the sooner you identify the cause, the sooner you can do something about it. When you go to your doctor, they will check several things. 1. Your urine. Did you know that after ejaculation, if you have retrograde ejaculation, your urine will look different? If it is cloudier or milkier than normal, it's because the semen your body produced took the wrong path. It's a clue that tells us what's happening. 2. Your medications. They will review your current medications to see if any are contributing to the problem. 3. Your health markers. They will run tests on your prostate, testosterone levels, and blood sugar if you are diabetic. Step 2. Medical and physical interventions. There are medications that can help. There is a medication called imipramine that can help strengthen that sphincter I've been talking about. It doesn't work for everyone, but for some men, it makes a big difference. There are also other medications like pseudoephedrine that can help in certain cases. But it's not all medication, gentlemen. There are exercises you can do. They are called Kegel exercises. These exercises strengthen the pelvic floor muscles, those muscles that control both urination and ejaculation. How to do them? The next time you are urinating, try to stop the flow midstream. Those muscles used to stop it are the ones you need to exercise. The trick is to do it when you are not urinating. Contract those muscles, count to 5, relax, and repeat. Do this 10 times, 3 times a day. It's like going to the gym, but without leaving your house. Mr. David started doing these exercises religiously. He called me 6 weeks later and said, Dr. Collins, I don't know if it's my imagination, but I think it's getting better. And it wasn't his imagination. The muscles were strengthening, and although he still had retrograde ejaculation, it was not as severe as before. Step 3. The power of communication. The true intimacy. Here is something that is almost never talked about, but is super important. Communication with your partner. Many men keep this to themselves because they are embarrassed, thinking their wife will think less of them. But let me tell you something I've learned in over 20 years of treating couples. Women are much more understanding than you think. When Mr. David finally talked to his wife, guess what happened? She cried, but not out of sadness or disappointment, out of relief. She told him, I thought you didn't desire me anymore, that you had found someone younger. All this time, she'd been creating her own stories in her head when the reality was completely different. Intimacy is not just physical, gentlemen. It is emotional, it is communication, it is connection. And when there is that connection, when there is that open communication, physical problems become much more manageable. Engaging question. What would you do if you knew that simply talking about this could strengthen your relationship more than any pill? Step 4. Lifestyle changes. The orchestra of health. What you eat, how you move. Whether you smoke or drink alcohol excessively, all of that affects your sexual health. Mr. Fernando, the diabetic gentleman, told me something wonderful when he returned 3 months later. He said, "Dr. Collins, I used to think that eating healthy and exercising was nonsense. But now that I'm doing it, I realize that everything is connected. I control my sugar, I feel better, I have more energy, and yes, things are also better down there." He is right. The body is like an orchestra. When all the instruments are tuned, the music sounds beautiful. Your heart needs to be healthy for blood to reach all parts well. Your nerves need to be healthy for signals to be transmitted correctly. Your hormones need to be balanced for everything to work as it should. And all of that is achieved with good habits. Eating well, moving, sleeping enough, managing stress. The final truth. Your value is not measured in volume. Let me tell you something else. There are cases where retrograde ejaculation does not have a complete cure, and that's okay. Not everything in medicine has a perfect solution. But that doesn't mean your intimate life is over. Mr. Roberts still has retrograde ejaculation. We adjusted his medicines as best we could, but we couldn't eliminate it completely without compromising his heart health. And you know what? He learned to live with it. He told me in his last consultation, "Doctor, at first I was very angry, but then I understood that the important thing is not how much comes out. The important thing is that I can still enjoy my wife, that I still feel pleasure, that I still have that connection with her. And that is what I want you to understand, gentlemen. Masculinity is not measured by the amount of semen you produce. It is not measured by how long you last. It is not measured by any of those superficial things that society has put into our heads. True masculinity is in how you face problems and how you take care of yourself and your partner and how you adapt to the changes that life brings." Engaging question. Which is more valuable? A man who functions perfectly but is a terrible partner, or a man with health problems who is an excellent husband and friend? I want you to know that if you are experiencing this, you are not alone. Studies show that between 20% and 30% of men over 60 experience some degree of retrograde ejaculation. But no one talks about it because we have been taught that these things are shameful, that they are taboo subjects. Enough of that. Enough of keeping silent. Enough of suffering in secret. This is something that can be talked about, treated, and managed. Final call to action. If this video opened your eyes or made you feel less alone, I ask you to do something very important. Give this video a thumbs up so I know this message is valuable. Share it with that friend, father, or brother you know is suffering in silence. And please leave a comment below and tell me what your first step will be. Talking to your doctor, starting Kegel exercises, or talking to your partner. And tell me where you are watching from. I love reading your comments and supporting your journey. Subscribe to this channel so you never miss a science-backed health revelation. Your journey to peace of mind and a fulfilling intimate life begins today. Dare to speak up. I'm Dr. Ashley Collins, and I'll see you in the next video.